high blood glucose in the type 2 is called HHNK, HHNC, and some places call it HHS. Who gets this? Which type? Type 2s are the ones that have the nons. Type 1 never has anything that has non in it. HHNK, hyperosmolar, hypoglycemic, non-ketotic coma. Well, this is actually one of the easiest questions you can get because it is very simple to understand. This is dehydration. That's all it is. Here's my point. Wherever you see the phrase hyperosmolar, hyperglycemic, non-ketotic coma, you can pull that out and plug in what word? Dehydration. Answer that question, you will get it right 100% of the time. So what would the skin look like in HHNK? Don't answer that. What would the skin look like in dehydration? Low water, hot, flushed, dry. What would be the number one nursing diagnosis that you would see with HHNK? We'll refuse to answer that. What would be the number one nursing diagnosis you would see with dehydration? Fluid volume deficit. What would be your number one nursing intervention or medical intervention for a client with HHNK? Well, I refuse to answer that. What would be the number one nursing or medical intervention in a patient who is dehydrated? Giving fluid. What would be some outcomes you would want to see in a client with HHNK? Increased output. Coming what direction? Up. Moist mucous membrane. All the things that you would like to see if somebody were dehydrated. What would the outcome of your treatment want to be? You'd want to see them saying, don't make HHNK hard, make it easy. It's nothing more than dehydration. This is dehydration. C says the signs and symptoms are like signs and symptoms of dehydration, and the treatment is rehydration. It's actually DKA without the K or the A. Because if you take DKA and you take the K out and the A out, what do you have left? Dehydration. That's HHNK. Which one is insulin the most essential in treating? Well, if I said HHNK and DKA, you would immediately change HHNK to what? Dehydration. And if I said, in what situation do you need to use insulin? DKA or dehydration? What would you say? DKA. So the answer is DKA. You don't have to use insulin with HHNK. All you have to do is rehydrate them because they are dehydrated. By the way, which one is more life-threatening? Which one has a higher mortality rate? More people die of HHNK or DKA? Actually, more die from HHNK. Which one, if a DKAer comes into the ER and an HHNK comes into the ER, who is higher priority? The DKA. Which doesn't seem to make any sense. Because I just said, who has a higher mortality rate? HHNK, but who's a higher priority? DKA. They come in a lot later because they don't have the acidosis, the ketosis that makes people see symptoms. And so they get worse and worse and worse. So by the time they come, they're already bad. But a DKAer is acutely ill with all these symptoms that we can quickly treat with a simple rehydration with insulin. You see, whereas the HHNKer will probably be treated with IVs, but probably is in such bad shape they're probably not going to make it anyhow. Now, who would die first if we didn't treat them? HHNK or DKA? DKA. But we treat them so they actually have a lower mortality rate